most of the versions coming out of the House was an employer's mandate, and it varies where the threshold is for the mandate. And I think the last version I saw was $250,000 in gross payroll. That if the firm isn't offering health insurance, then they have an 8% surcharge, basically a tax that they pay, and for those people to go into the public option. But let me talk about the problem with that. And that we're in the middle of a very deep recession right now. And I was a small business owner, and I wasn't able to afford health insurance probably for the first 7 years of my small business, until I could get into where I could afford health insurance for my employees. But I was still creating jobs and economic opportunities. Right now, to put that 8% surcharge down on small businesses that don't offer health insurance will be a job killer. Yeah. Walmart actually supports the public option and the employer's mandate issue because they offer health insurance for their employees, and they're low-cost employees. And so they figured that 8% is cheaper for them to push their employees into the public option. And then some of their retail competition don't offer health insurance, but they'll be stuck with an 8% surcharge that will give Walmart a greater competitive advantage over other retailers. But, government taxes. So I think that, we've got to look at where this economy is right now. And can small business afford Rick, S-C-H-I-C-K.
Congressman, we certainly can appreciate the absolute complexity of this problem. Projections are, and I'll share a personal experience. In early July, my dad was 82 years old, went in for a simple procedure. And he's still alive by the grace of a pulmonary guy, a heart guy, a urinary guy, you name it, he had it. And I don't know what, it's more speculative than anything for me, as I am witnessing the debate and realizing my dad's going through something, that would somebody decide that, okay, he has this problem now, and it's probably going to cost us about another $500,000 or $600,000 to have this 82-year-old man alive. Is it worth it? Yes. Well, but the problem, and I am openly, I'm very conservative, so I'm not arguing that the answer, of course, would be no. He's my dad, and all of you have parents and kids. But the challenge really is Medicare. Medicare is great for my dad, but it's going to be, it's broke, and it's going to be, by the year 2050 or 60, our kids are going to pay 60% of their income just to cover the medical cost of this country. And I don't know how they fix that. So, that's just for medical. That's not to pay the congressman's salary. So, this problem is extraordinarily complex, and I think it needs to be taken one bite at a time. That's how you eat an elephant. And what we're doing is not eating an elephant the right way.